this week we're continuing our theme from last week of looking at good charts, or as I think you pointed out last time, Ollie, relatively good charts, because we are medical herbalists, so we're seeing people who are not well generally. These are charts of the consultation, astrological charts for consultation, which are a bit more propitious and promising. And I think you brought a chart with you, Ollie. We did in the last episode cover some of the things that you might expect to see in a positive chart, so I don't think we need to recapitulate those now.
No.
But okay, let's go. Let's have a look at exciting.
Okay, I'm going to put the chart up, I think, because I think that will, and
Okay.
then it might make a bit more sense to everybody. Okay, so this was a young man I saw in January last year, and he came to me with severe, well, digestive problems. Eating made him nauseous. He was often sick after eating. It had recently, in the last year or two, got much worse. But he had basically said he could never remember a time where he hadn't felt nauseous after eating. And
Oh, wow.
yeah, so, and a little bit of history. He had, well, his parents reckon he had caught Giardia? Yeah, I never pronounced it
Yeah,
right.
giardiasis when
Giardia,
traveling.
yeah.
Yeah,
While traveling when he was young, sort of 7. So,
yeah.
but they had had numerous doctors check for it, but it had never come back positive to tests, yet he had many of the symptoms, and they were convinced he did have it. And obviously, it's one of those things that the tests aren't particularly accurate, so I wasn't going to discount it
Yeah,
as a
but and
possibility.
also, Ollie, just on that, I've seen a number of clients with long-term IBS that's kicked off ever since they've been traveling and caught giardiasis. So it
Right,
does
yeah,
seem to be this thing
exactly.
that triggers long-term low-grade inflammation even after the infection is apparently cleared up. So yeah.
So now, one of the things on this chart that I found interesting was that, well, you might see things differently. It wasn't particularly radical. As you can see, the patient is ascendant is the moon, and obviously he's the moon as well as his body. So that's that.
Okay, just for any of the beginners here, we've got, you mean the ascendant is 5 degrees of Cancer,
Cancer,
which
sorry,
is
yeah,
ruled by the
the
moon
moon.
at
Yes,
27 degrees Aquarius up there in
Aquarius.
the ninth house. Yeah.
Okay, and the sixth house is 28 degrees Scorpio, which is ruled by Mars,
Yeah.
and Mars is in the 12th house in Gemini.
Right.
Now, I did think, well, that is interesting. This is a mystery illness he's effectively got, which I actually said the doctors are baffled by it. So I thought that's quite, yeah, and the 12th house traditionally is the house of
Yeah, the
secrets,
hidden.
the
Yes.
hiddenness. So I did think, well, that is interesting. That it does seem to be rather hidden. So I thought, okay, well, it's a little bit of radicality there. Um, Other points on the chart that I noticed that the moon, which is signifies the patient, is just coming out of a conjunction with Saturn and Venus.
Yeah.
Um, so I thought, well, it's probably quite a good sign that that could represent the illness that he's had, and it's things are possibly starting on a mend. And I did wonder as well if that Venus-Saturn conjunction might make this is a chronic condition which is kind of caused by nice things, sort of thing. I don't know if that's a bit of a stretch, Marcos, in that
Caused by.
nice things like food and
Oh yes, yeah,
pleasant
definitely,
things.
definitely the moon. That's not a stretch at all. I'd say I'd follow you around that bend, Ollie, because moon separating from Venus would show some predisposing issues, and Venus here ruling the 12th house of
Yes,
vices and self-undoing and secret things, and the fifth house of parties and feasting and pleasures.
yes,
Uh, in the ninth, it might imply that something associated with pleasure and while traveling or overseas may have predisposed them to it. And then, as you've mentioned, Venus is actually closely conjunct Saturn, just separating. So there's something a bit mucky, sordid. So that could be literal muck, as in like dirt in the food, or
Yeah, yeah. I
something
mean,
sweet that
I think
they've
very
consumed,
much.
or it could be in another context that could also be implying a venereal disease, although that doesn't seem to be suggested here
Wasn't the
by the
case here,
context.
but he was very much allergic to a lot of foods as we were here.
Right.
So
Okay, so it's something about the fruit, and fruit is a Venus thing. Yeah.
exactly, yeah, yeah. But I thought positively, the next conjunction that the moon makes is well, the next aspect the moon makes is with Jupiter, which you can see there on the cusp of the 11th house in
Oh no,
Aries.
no, no, I would say no, because the moon moves into Pisces and then it goes to sextile.
Oh God, you're
Oh no,
quite
it goes
right.
to
Yes,
square
sorry.
Mars, doesn't it, in
It does, it
Pisces?
does. That's why now it's all coming back to me because that's why I was thought that's not a good thing. Why would that be that sextile to Mars? I knew it was too easy. So that was something that confounded me. I thought, okay, this is interesting. It looks like the moon's coming away from the problem stuff, but it's moving into something that this sextile with Mars as though, and
Yeah,
so that
I would, yeah, that's an interesting one because what we've got here is just to sort of unpick this a little bit for the listener or for the viewer. We've got the ascendant rule of the moon is technically void of course, meaning
yes,
nothing's happening for a little while because the moon's at sort of nearly 28 degrees of Aquarius towards the end of the sign, not making any further aspects before she leaves the sign. So that implies there's a bit of a delay, there's a little bit of powerlessness. And then the cusp of the sixth house, which represents the disease, has 2856 Scorpio on it. So there's like that to me implies there's an imminent that disease has been going on for a while. The
which
symptoms
it
have
has,
been going
yeah,
on for a while, but they're towards the end, after about a year or a month or some fixed unit, just over one fixed unit, the disease might change because we've got this. They're both the ascendant ruler and the cusp of the six are in the last degrees of those fixed signs. So
right,
there's
right.
some delay follow. There's a delay, but then there's an imminent change after a delay. The delay comes from the fact that both of them are fixed signs, which are slow, but the imminent change comes from the fact that both the sixth cusp and the moon are towards the end of fixed signs, and the ascendant is Cancer, which traditionally was a movable or cardinal sign. So
Yes.
none of the angles are nailed down. So does that track with your experience of what happened in this case,
Well,
Ollie?
it
I
was
mean,
an interesting one because
there are a couple of other things that
there we
I sort
go.
of thought here in terms of where things were headed. You pointed out that the moon uh, was going to change sign into Pisces, where
That's right, yes.
the moon's pretty comfortable in Pisces. She
Well, it
likes
is, yes,
Pisces.
yes.
So there's a gain in dignity there. So it's like after there's a short pace, there's a gain in dignity. But then, as you pointed out, that the fly in the ointment is that the moon is then moving towards the square of Mars in Gemini, which is the
That was
ruler
my
of the
concern,
sixth. So there
yes.
might be more than one inflammatory episode affecting the stomach or bowels or whatever, the moony bits, imminent. There might be some worsening attack. But yeah, there's a really interesting
I mean,
um
the thing was he responded incredibly well to the treatment,
okay.
which was it was one of those things that there was quite a lot of dietary advice. He had it was terrible. I mean, he was at university, he was having university diet.
Okay.
So I basically told him he had a very, very carb heavy diet. And I told him to back off on the carbs, particularly beer, which he was very fond of. So he gave up beer completely and switched to spirits because, again, this is one of those interesting things, just as an aside for herbalists.
Uh-huh.
Ideally, I would have asked him to give up alcohol, but there's no point asking, a second year university student to give up alcohol.
Yes.
Um, so I, but
Well, that's an interesting one, Ollie, just from the point of view of the drinking, because Venus also doesn't just rule fruit and sweet, she rules
right, yes,
booze.
yes,
And Venus ruling the fifth house of parties and the 12th house of self-undoing
yeah.
in the ninth house. It's probably not just dirty food. or and sort of it's the parties, and it's just getting knackered and a bit
Yeah.
battered through partying a little bit, I think.
And it
Yeah.
was, and I think there was a lot, the beer was really upsetting his gut. It was fermenting in his gut very, very badly and
Okay.
exacerbating all. So he switched to spirits, basically.
Okay.
Thought he had terrible gourd as well, which he sorted out with marshmallow, which
Right.
herbal
So bad
Venus, of course.
reflux. Okay.
Yes, very bad reflux. And then now, uh, how did we work this? Yeah, the 10th house is ruled by Jupiter,
Yeah.
and Jupiter's very strong in this chart,
Yeah.
relatively strong. So agrimony, because he had terrible diarrhea and things, and obviously wasn't digesting his food, a lot of fatty stools.
Okay.
And so for a sort of and agrimony is good for the pancreatic external pancreatic support, which it seemed to need as a to just get all that fat digested. Willow bark to reinforce the moon as a
Yes.
willow,
Because
and also
agrimony is. Yeah.
calms the gut. And chamomile is a general, just a nice, wonderful gut herb
Yeah,
for the gut.
absolutely. Camomile's brilliant, isn't it? So we've got a herb of agrimony is a herb of Jupiter,
Yeah,
willow is a herb of the moon, and
correct.
camomile's a herb of the sun. And we've got the moon rules the ascendant, so we want to strengthen that.
That's right.
Jupiter's ruling the 10th house of medicine and in reasonable shape in its term in the first degrees of Aries and on the cusp of the helpful 11th house. And it's a daytime chart, so a bit of the sun wouldn't go amiss. So yeah,
Correct.
nice.
And also meadowsweet and peppermint and fenugreek tea as well. I
Okay,
don't
so
actually know if fenugreek has a planet associated with it. I think
fenugreek, I'm not sure. I think fenugreek might be Mars or Mercury, but I'm not sure.
I did wonder because of its smell and stuff whether it was a Martian herb, which would be
But
then
it might be too. It's not quite pokey enough for a Martian
no,
herb for me. But it is a bit spicy. I've found fenugreek quite hard to classify because it does one of its effects is it raises testosterone. It's quite spicy, so that might suggest Mars. But then it's also mucilaginous and sort of demulcent and a bit slimy and lowers cholesterol, which is also like Venusy. So it's a bit of a weird one to classify that. I had wondered whether it might be um, a Mercury herb because it sort of takes on features of more than one thing, but I'm not sure with fenugreek. I've not been able to place that one
right.
myself.
I didn't give it on this time round. I didn't want to do, but oh, later on in the treatment, as sort of things, this had a very good effect. Particularly, I mean, and again, this is a good herbalist trick, isn't it? That like if something's really bothering somebody as a symptom, like and the reflux was really bothering him, giving
Yeah.
somebody like the marshmallow just solved it like that. And so
Yes.
suddenly he was incredibly compliant because it's like, oh shit, this works
Yeah,
in
no, that's
24
brilliant.
hours
It's
sort
like
of thing.
when you do that thing where you the patient gets a good result and sees results quickly, then it's
Yes.
always incentivizing for them. It's like, oh, this is doing something, which is great. Yeah, so you were kind of using the Venus stuff sort of in antipathy to Mars, the ruler of the six, because
Exactly.
yeah,
But I was a little bit wary about some of the Martian stuff just because I thought about bitters, which is nice, a bit of wormwood, something like that, which is very Martian. And I just thought it might be a little bit too pokey for his very, very sensitive stomach that he did anyway. So
yeah.
I thought I wanted to get things under control
No,
before.
I agree. So the principle we're sort of talking about here, folks, is that Mars is the ruler of the sixth house of illness in this chart. So it's kind of like in this chart, in terms of disease, Mars is sort of the enemy. But you could use herbs or treatments that were astrologically ruled by Mars if you were wanting to strengthen parts of the body ruled by Mars, like mainly the gallbladder, let's say, but also possibly debatably the adrenals and the thyroid. Modern astrologers would say they might have a Mars rulership. But if you're not wanting to strengthen those parts of the body, generally we want to oppose Mars, and generally that would be with herbs of Venus or the Moon, because those are traditionally the antidotes to Mars. So Ollie, you were saying you were using here marshmallow and meadowsweet, which are both Venus
Yes.
herbs. Plus, of course, you had a bit of of willow bark in there, which is anti-Mars in another way, because it's sort of anti-inflammatory, and
Yes.
inflammation being a Mars process. The herb that I've always found really helpful for reflux, a moon herb, which is really good to have in your bag, because while there are lots of moon herbs in Culpeper and in the old herbals, we tend not to use
Odd that, isn't
you
it?
know what I
Yeah.
mean? There are hardly any in the Materia Medica
Yes.
stuff we can actually easily get hold of these days. So like there's maybe wild lettuce and then willow, and then you're sort of struggling a bit.
Yeah.
Chickweed, but so the one that aloe vera, aloe vera.
Right.
It's,
Yes.
it's it's
Yes.
fantastic for reflux, and I found that's a really good moon herb for reflux. But so
That's nice.
what you gave him worked really well, particularly the marshmallow. So
That
you're
worked very
kind of
well. And then, I mean, he was ready. He was, yeah, when I had the follow-up 3 weeks later, it was like, oh goodness, I've been able to introduce small bits of food that I've never had before. I've never had nausea-free days, like as long as I can remember, and now I do. It's just blah, 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 blah.
so
So
it was
it's like,
enormously successful.
so it's enormously successful. So
Did that success maintain?
yeah, well, since I last heard from him in March this year, and all was well. And
Okay.
so
So it did. So here's what's interesting, folks, because obviously we're looking at this. This chart was, we don't really have anything in this chart that's like screaming success, but there are a few things that are interesting here. We've got the signs on the cusp of the six and the sign of the ascendant ruler are about to change, which shows some imminent change in state.
right,
And the
yes,
fact that the ascendant ruler is about to move into a place where it's got more dignity rather than less. The moon is more comfortable in Pisces for sure than she is in the late degrees of Aquarius. I think she might actually have some minor dignity in
I
those
think she
late
does.
degrees of
Hang on,
Aquarius. I think she's
I
got
did check
face.
this.
She's in face where she is. So
Yes,
she's not totally knackered.
no,
But she moves into, I think in the water signs, all the water signs, the moon has what's called participating triplicity dignity, which is actually stronger than face. It's like the moon is naturally of a similar nature to the water signs. Except for Scorpio, where she doesn't like being in because it's ruled by her enemy Mars. The moon generally likes the water signs. Yeah, that's happening. But then the other thing that I noticed that's really interesting, obviously the seventh ruler, which would be you or the therapist, is pretty strong in
right,
Aquarius and is
yes,
placed in the helpful, moderately helpful ninth house. Um, it's moderately helpful. It's a helpful house. It's just not super strong. Do you know what I mean?
yes,
It's very helpful. So, but you've got a very strong Saturn there,
yes,
which is receiving the moon. So it's sort of able to look after the moon a little bit. So the seventh ruler Saturn is moderately dignified, but not in a place where it's super powerful. But then the thing that caught my eye, and I think we're maybe looking at something interesting here, is the Mercury right on the cusp, on the seventh house cusp.
right,
That Mercury. Now, Mercury is the ruler of the fourth house, which symbolizes the sort of the end of things.
right,
And it part rules the 12th house, which is interesting because it's like the house of hidden enemies and stuff, but it's in the power of the seventh. It's in the
yes,
power of the physician. And it's being called attention to because it's right on that angle. Now, what's interesting me about that Mercury is that it has a generosity with Mars in the 12th,
yes,
because Mars is in Gemini, which is
Gemini, yeah,
Mercury's sign. So Mercury rules Mars, and Mercury is in Capricorn, which is Mars's
which is
sign of
also, yes,
exaltation.
yes,
Yeah.
right,
So
yes,
there's a resonance. It's like if they were both tuning forks and they were struck, they would make a harmonious vibration, and one would be causing the other to vibrate even more, and so on and so forth. So what I think this is interesting because it's actually, I think what it's showing is something about the end of the matter maybe being in your hands or the physician's hands, and the
right,
physician having a degree of power over the disease
interesting,
through the mind, through
right.
Mercury, through what's said in a way, through the
Yeah.
conversations that take place,
Well,
something along those lines.
I did think that a lot of it was down to advice given and taken rather than necessarily, the herbs always help, but he
Yeah,
did
yeah,
make
yeah.
major changes to his life on my suggestion.
Right, which is very interesting, and
I
that's
mean, he
maybe
was a
the
massively, again, this is something that I don't know if anyone, but on a humoral basis, I mean, I didn't check it out from the chart, but just from looking at him, he was a typical sanguine person, like big and fleshy and
Okay.
red and very humorous and boisterous. And so, you know, so I did think and they can often be quite good patients.
Yeah, oh, definitely. Yeah, they're a lot more amenable to taking suggestions and
Yes.
more optimistic, and that's conducive to a better result for sure. It's just from the decumbiture chart, I think, because when we were talking about all the factors that could create a good result, I mean, this chart is not screaming bad result, but
No.
it's as you said earlier, like when we spoke beforehand, it's like it's not screaming good result either. It's kind of like a, but I do think what we've got some potentially really quite interesting take homes, because what we talked about in terms of principles before was like, okay, for good charts you might be looking at angular benefics, like assuming they didn't rule naughty houses, like, you know, Venus or Jupiter if they're on angles. Well, we do here have Jupiter squaring the ascendant and elevated. I mean, a
Right.
square
Yes.
to the ascendant might imply, because Jupiter rules the 10th house of medicine, that it's somewhat like some of the medicines may be somewhat stressful for the body, but overall, Jupiter in a daytime chart where Jupiter enjoys being in its own dignity on the cusp of the 11th house, which is a very fortunate house, isn't going to super stress the body out. If that was
No.
Saturn
No.
or Mars, you might expect,
Yeah.
if ruling the medicine squaring the ascendant, you might expect the medicine to be a mixed bag, you know, like
Right.
it'll
Yes.
it'll do some good, but it'll cause some pain. Jupiter there, I mean, at worst, maybe the medicine will fix his digestion and then he'll overeat and gain a bit of weight or something like that. Do you know what I mean?
Yeah.
It's
Yeah.
more
Yeah.
in that along those lines, perhaps, which might not be a bad thing if he's had IBS for ages. But so I think that's the angular, and the fact that Jupiter's sextiling the sun is very positive too.
Yes.
Um, Culpeper says when Jupiter is trining or to a lesser degree sextiling the sun, you need never fear for the life of your patient. Well, obviously,
I
this
didn't come
wasn't
across
this
that
wasn't a
one. That's
patient who's
nice.
coming in on death's door, but you know, the principle there being that it's generally a good
Right.
time. But I do think that that Mercury being right on the seventh angle, or, you know, within a couple of degrees, it's really shouting.
Right.
And I'm not sure I'd have guessed at such a good result from it, because of the fact that it's in the detriment of the moon, the ascendant ruler. But then
Yes.
anything in the seventh house will be. But I think what it is does have that generosity with Mars. And I do find, and a modern word for generosity is mutual reception, although that is technically incorrect, because in the tradition, to have a reception, you had to have an aspect.
That's right.
So,
Yes.
so this would be generosity if we're being stringent about the labeling. But I do think there's something there about having the Mercury in the power, because if it was on the seventh house cusp, I would say it would be controlling the seventh house. You know, if you
Yes.
look at those horrors about court cases or wars or battles, if you find the ruler of the first on the seventh cusp, it's like that person's going to win. But if you find it
Yes.
in the
Yeah. Because
seventh
they're,
cusp,
yeah.
they're going to
Yeah.
lose.
Yeah.
Because, in other words, it's showing that whatever Mercury is in the power of the therapist, in this
Yeah.
case, you. And that Mercury is that having a resonance to that Mars, I don't think is accidental at all. So there's
And
something
that's
about
interesting. So
practical advice that you've given Mercury and Capricorn that's really helping to him to get control of any self-undermining or illness-driving mental constructs and behaviors, something like that.
yeah. No. No. That sounds great. So that means that's
It sounds great. I mean, it's a good retrospective. I think that what I've predicted from this, if I was being purely solidly, you know, hardcore predictive about it, I'd have said no change for a little while, then an improvement, And then after a while, the possibility of more than one digestive upset. Medicines should help, but maybe a little bit upsetting to the
Which is
system.
interesting because he did, though immediately we had very good effects, was a bit of backslide, there were some hiccups down the
Okay.
road, which
So
is
he
why I
might
saw
have
him
run
for the
into a bit
year.
of, yeah, so that ish, and Mars is often Mars is hunger, isn't it? Appetites in general. So I'm
Yes.
wondering if he might have just backslid into a few naughty eating
Yeah, I think
behaviors.
so, yes.
Yeah, yeah, which might have triggered his gut off a couple of times as the moon came to the square of that Mars. But then, if I remember correctly, sort of 2023, that Mars just wound onto a trine of Saturn,
Did.
and so it's like you, as that dignified Saturn in the ninth, were the final dispositor of this thing. Were you were the end of the line of this thing. So that in this context is a good thing. I mean, the only negative thing is we've got Saturn is the ruler of the eighth as well,
Yes.
but we have no reason, the eighth house being the house of death, but we have no reason in this chart or scenario to invoke the spectre of imminent death. So
No, because,
it's
yeah.
much more likely that this that final dispositor would indicate an end of the disease in the context of both his symptoms and diagnosis and the fact that the chart shows this imminent shift towards improvement. So it's a really interesting chart, Ollie, and is it a bit more
It is I
nuanced?
mean,
Yeah.
the other thing which is significant for me personally, and I don't know if
Mm.
that's shown in the chart, is that it got me a lot of patience because I had a move out of London, and I restarted my practice like after COVID and sort of end of 22, a new
Yeah.
place. So and this patient's family, basically, I saw all his family, then all their friends, etc. So it was a very, it was a one of those sort of
Super
germinal ones,
connector people.
like
Yes,
this
like
guy's amazing, you must see him, sort of thing.
yeah,
So
which is wonderful when that happens. You
yeah.
get a patient who you help and they refer you to everybody, and that sort of like one in every 20 patients is like that. And then, they bring everybody they know to see you, which is that's interesting. And again, I wonder what is that shown in the chart? That might be shown perhaps by the Mercury, by the Jupiter, I was going to say on the 11th.
Right,
I
the
wonder,
friend,
but
yes.
maybe also that has something to do with the Mercury Mars um uh generosity too, in the sense that you've got somebody broadcasting your ability to overcome illnesses, hidden illnesses,
Well,
something like that.
interestingly as well, now I look at it, because his mother would be represented by the 10th house, if I'm correct, yeah?
Yeah.
And she was the one who sent him to me, being king.
Ah, okay.
And she was the one, I suspect, who sung my praises rather than him. So that might make sense, as that strong Jupiter on the cusp of the
Yes.
11th,
Yeah,
her friend
yeah.
sort of thing.
That's interesting. So because yeah, Jupiter is definitely the most helpful planet in the chart. And what's interesting to me, just to point this out for people who may be fans, who may be astrologically minded listeners who may be fans of different house systems, let's say, if we were to use the whole sign house system, this we would be interpreting this chart quite differently, and it would put the sixth house would be ruled by Jupiter, which in
Oh, yes,
this
it would, wouldn't it? Yes, yes,
it
yes,
would, which in this
yes.
context doesn't make as much sense, because, and this is why I prefer using, one of the many reasons I prefer using the quadrant houses in interpretations. I do use the whole sign system really for looking at sort of power and relationship to the angles a little bit and add a bit of nuance. But here it's clear to me from the scenario that the midheaven is not ruled by the same planet as the sixth house, because if
Yes.
that were the case, then the medicines would absolutely have produced side effects. That is invariably the case, and in this case they did not. So um anyway, just a little point.
Just a point we'll put in the evidence box. Yeah.
Yeah, yeah. Yeah, exactly.
Brilliant.
Exactly.
Well, thank you again. Let me just unstop sharing. We'll get
No,
back to
thanks, Ollie. Really,
Stacey.
really,
There we
really
are. That was
interesting chart.
fascinating. Thank you.
No, well, thank you for bringing it. That was a really interesting chart. So it's always interesting to look at the charts where you're kind of like, huh, okay, that's you can, So just if, as I say, if I'd have got that as a consultation chart, I wouldn't have been so optimistic just from the chart alone.
Right.
But it's I think this is when you're using astrology predictively. I think this is speaks to something important, which is to use the astrology as a framework for generating ideas for
Yes.
treatment and to enhance your idea generating and possibility generating, but not to get too locked into a specific prognosis. It's sort of almost like you do a bit of prognostic work and you generate the treatment with it, and then you just keep it in the corner of your eye.
Yeah.
And
Yeah.
I think that's often the best way to use it. Um, yeah, there's a friend of mine, Sharon Knight, who's an astrologer and a herbalist as well. Though she's not a full-time herbalist, she's a really good astrologer. And she had breast cancer a few years ago, and she used astrology when she got breast cancer, but she only did a solar arc. She did like one chart and then found one significator in the chart and was like, that's me, and I'm waiting till then. And when I asked her, because she does all the traditional astrology stuff, she knows how to do decomposition, and she said, look, I was afraid if I went in too deep, I'd get locked into a specific
Yes.
outcome. So
Yes. Yes.
she
Yes.
was really smart. She just looked at this one chart, got the one significator changing sign, and said, right, by November, and the significator was Mars. She used Mars as her significator for multiple reasons I won't go into here. And she saw that it was moving. It was in Pisces on Shiat, and she just used her solar arc for some reason, which it's not a very traditional technique, but she just used that because she knew that she's like, that's me right now, Mars
Right.
on Shiat. And then she said, in this many months, it's moving into Aries, and she's an Aries sun, so she was
Right.
like, good. So by November, so she just used loads of herbs with Mars in, like she was
Right.
having ginger and chili and stuff in smoothies, and getting herbal treatment from a herbalist friend of hers with some, I think they use bloodroot
Oh, that's powerful
sanguinaria.
stuff. That's
Yeah, very
super pokey.
pokey. Very pokey, and had amazing results. So, but what was really smart about that was she didn't lock herself in too tightly to a prognosis. So, as somebody who's a massive perfectionist and likes to like really predict things down to the minute, it's something that I sometimes struggle with, not to over predict.
And
It's like,
also,
yeah,
it's a relegate. I mean, we're looking at these charts so we can make our patients better. And so there's no
yes,
point looking at a chart and thinking, "Oh, there's no point intervening.
yeah,
It's
yeah,
too."
exactly.
I
You're
mean,
trying to open up possibilities,
exactly.
but you also don't want to be Pollyanna and ignore
No, of course
negatives,
not. But
but
it's worth saying.
erring on the
Like,
side of
as we
opening up
discussed in this
possibilities.
one,
Yeah.
there's going to be this square to Mars or whatever. We need to be careful about relapses, but knowing that, we can then cover that off, sort of thing, and
Yes.
warn
Yeah.
people.
Yeah.
So
Yeah. Exactly. Exactly. So really interesting chart, Ollie. So thank you for that.
brilliant. Well, thank you very much.
Brilliant. Thanks, folks. All right. Thank you for watching. If you've liked any of this nonsense, please like and subscribe and share and do all the things. And please do, because the more the merrier. We're trying to grow our tiny channel into something substantial. So that would help. Anyway, hope you've enjoyed it, and
Till
see you all
next
next
time.
time. Bye. Bye.
Bye bye.